Pull the microphone back down. Well, that was a great insight into an exciting project for us, and we're anxious. We appreciate Paul Sturm and the Pullman School District Board of Education and their support of beginning this here, and we're anxious to extend it out into the other school districts in Whitman County over the next few years, and we think it'll bring great results. So innovation doesn't always have to mean technology. It's a great facilitator and it can do wonderful things, but sometimes our innovation is simply looking at how do we bring or organize the resources that are in a community differently. How do we change the incentives and the focus that we have so we might get a different, better result than we've been getting. And our final presenter tonight is going to help create some framework around which that conversation might start to happen. Craig Dolezal is with Aon Hewitt. Aon Hewitt is a national, actually probably a global company and consulting company in health benefits or benefits, especially health benefits. And he's a senior executive with them. He's been with Aon Hewitt for 26 years. And we invited him here as a way to jumpstart the conversations that we hope to keep having with people like Brian and their company and other partners like the school district and Community Action Center here in town and WSU and Police Knowledge Corridor and others. We hope to maybe begin to have a deeper, more expansive conversation about what healthcare can and should look like in Pullman and the surrounding region. So I'm going to turn time over to Craig Dolezal from Aon Hewitt.
So I'm keeping you from going home and resting, I think, so I will try to make this impactful but as brief as you'll allow me. As Scott said, I work with Aon Hewitt. I've been there for a very long time doing this consulting thing for 26 years. And I've worked and been privileged to work with organizations, large and small, trying to do great things and small things in healthcare. And when Scott asked that we come in and have a conversation about innovation and building a community of health here in Pullman, Washington, it was particularly exciting to me for a couple of reasons. One, there are a lot of very large communities that have looked at the thought of building a community of health. And as a lot of you have said tonight, it's easy to have the big idea. It's very hard to pull it off. And so in a lot of very big communities, a lot of good ideas happen. Nothing ever progresses. You need a catalyst, a spark that can create that level of innovation. And I'm just amazed what I've heard and observed and listened to tonight here in Pullman, both with the hospital and the folks that it employs, but also the people that have a chance to work with and for the hospital. So I'm going to spend some time talking about macro context of healthcare, not to bore you, I hope, but just to give you a frame of reference for what's going on outside, and then try to bring it to a little bit more focused on Pullman and what you guys could possibly do to start having the conversation around building a community of health that works for the stakeholders here in Pullman. The other piece of this, so I've been a consultant, and a consultant, does a lot of things, and there's jokes about what consultants do, and I'll try not to tell them on myself, but if it helps, I will. But I also so I have the unique privilege of, and this was before HIPAA, so luckily I'm not going to violate anything either. I'm the parent of a child that incurred the largest claim at Hewitt Associates, the firm I worked with before Aon bought us, twice in his lifetime. So we were a $2 million claim child of mine. So, and I got to observe the healthcare system in a extraordinarily profound way. He's fine. He's a senior at college at University of Michigan, and he's doing well, but seeing healthcare at that level of intensity creates this urge and this desire to make it better, and make it better for everyone involved, not just the patient, not just their family, but also the providers that serve them, the therapists that have a chance to try to make their lives better, and the employer who's footing the $2 million bills for his care. So I have a great passion for healthcare, and I hope that we can move the slide forward. So I'm going to spend a second talking about the marketplace. I don't know if you guys have been reading the newspaper at all, but there was this thing called the Affordable Care Act that has created a little bit of buzz on some secondary media outlets. And so, as I said, I've been doing this a long time. We have tried really hard to create innovation and change in healthcare, and it's been a truly glacial revolution for 24 of my years. The Affordable Care Act, however you feel about it, we're not going to talk about the political aspects of it. The Affordable Care Act is the single greatest catalyst to healthcare change and innovation in this country, and it wasn't what it was intended to do. But it's a massive change that is driving a lot of stakeholders in the system to rethink their responsibilities and their accountabilities and to think about how to work better together to accomplish the goals that they have. The graphic just shows some of the key catalysts that have been going on in the four primary stakeholders. I'm going to spend some brief time talking about all four of the stakeholders, which include providers, most certainly, the health plans, individuals, and the employers. And that change and that swirl and that chaos that everyone's feeling is creating both incredible anxiety and stress and problems, but also some opportunities that I think Pullman has the opportunity to take advantage of before there's a crisis, before there is an urgent requirement that you do something different here because someone else has come in and told you have to. That's leadership, that's strategic thinking, that's innovation. The other challenge with the Affordable Care Act is, despite its complexity and length, it really hasn't yet sorted out how to solve the underlying problem that we're facing here in this country with healthcare, which is a number of gaps that have been created over the years, not through evil intent from any part of the system, but because everyone's working to try to figure out how to maximize their position in the system and minimize their cost and risk. And as a result of that, we have some gaps at the community level that have resulted in what's shown here on the slide. If this were not healthcare, if this were another kind of business, or this was your own family circumstance, would any of us live very long with these 6 challenges that we have to live through? Increased costs, poor outcomes, inefficiencies, fragmented accountability, who's on point for what, and loss of sort of performance and outcome. So the healthcare system has been living with these gaps for a very long time, constantly trying to find a way to come together, but never finding a way to come together certainly and perfectly. And that's partly because we've never had the drive to do that. And the drive can come from outside, but it has to come also from inside the community. And that's what I'm so excited about with having a chance to listen to Scott and his team earlier today. There is a true desire to close these gaps here in Pullman, but it will require all parts of the system to have a desire to do that. It can't just be driven by one part of the world here. So I'll spend a second talking about what our large clients care about. There was, and again, I know you guys all aren't policy wonks. I will try not to bore you with policy issues, but there's an element to the Affordable Care Act that has gotten the attention of every single client that we work with, which is the Cadillac tax or the excise tax. And the provision, as simply as I can state it, is in 2018, if an employer's plan crosses over a certain cost threshold, that employer's plan, whether they're self-insured, fully insured, and it doesn't matter, will be subject to a 40% excise tax on the cost above that threshold, and it will be a non-deductible tax, meaning it's a full impact cost. So, I know at least one CEO in the audience. In the board meetings and CEO meetings I've had, not a single CEO would willingly and knowingly pay a 40% excise tax if they can help it. Just not good business, right? And so this is driving employers to rethink their whole relationship on healthcare with their workforce. Because if costs continue to rise at the rate that they're rising and reach a level that crosses that threshold, it will create business implications and coverage implications that will have a very direct impact on us, and we won't be able to control what happens. It'll happen to us. So this is the number one issue for employers. Will we cross over that threshold? And when we do, what can we do differently? The other issue in the Affordable Care Act created a floor for how rich benefits could be provided to the workforce. So there's a floor, a 60% of value floor, and there's an excise tax, and at some point those two will come together and potentially squeeze out employers from providing health care still to their workforce. Interesting concept. Again, I will be retired the day before that occurs, I believe. So given that change in the Affordable Care Act, and the fear of the excise tax and the challenges that employers are facing, they have an opportunity to either curl up under their desk and just weep until this is over, which isn't usually a long-term solution, but I've seen some of my clients do that for a second. And as a consultant, I get down on the floor and weep with them. It's just what we do. But mostly they look at opportunities to do things that can help their employees, most certainly, but also lower their cost and exposure. And this infographic is just a small representation of the kinds of levers and tactics that employers are looking at to try to figure out a way to provide competitive benefits at a cost that they can afford while they have to do that. It's interesting. So, Brian, your company is fascinating, quite frankly, and what you've been able to do is outstanding. That's just one element of trying to find a way to help one part of the system deliver an outcome that's profoundly different than that's never been possible before. Employers love those stories. They're just never sure if it's enough of a movement for them to jump in full bore. So we need to have the patchwork quilt of solutions created, just like Brian's company is doing across the whole spectrum of healthcare, and we have to figure out who's going to help drive that change. And I can honestly say, and I love my clients to death, literally, they will not be the purveyors of innovation in healthcare. They're looking for the exit door right now, and it might be down a long hallway still, but they're not looking to double down on their responsibility. They're looking for someone else to do that. The health systems, the hospitals, the providers, the other therapists and providers have to take some ownership and leadership again to drive innovation in healthcare, and that's what our clients are hoping for, because they're not going to do it themselves. Then we talk about the individuals, the consumers. We do a study every year with the National Business Group on Health, where we actually go out and talk to people. So it's not a survey. It's literally a face-to-face set of focus groups of about 3,000 average consumers or employees. And this is just a very busy graphic of all the things that we get a chance to hear when you actually talk to live people about how they feel about health. There's a couple interesting stats or perspectives in here. One is, people really don't know they're not healthy. We have a wonderful tendency as a species to think we're better than we really are, or healthier than we really are, and it plays out in this study. We also have, there's an interesting dynamic here, which people don't trust the government, they don't trust their employer, they don't trust a lot of other people. They trust each other and they trust themselves on health much more than and their provider much more than any other place they can turn for advice. And that's a community-based solution if we can just find a way to leverage it. The other interesting part in here, which I just always find fascinating, is they always think they spend more than they really do, and they think that their employer spends a lot less than they really do. But that's just, I guess, human nature as well, that we always think we're on the short end of the stick. The point of this is, in the end, it's the individual that we have to deal with, because healthcare happens between a patient and a provider. It doesn't happen in a boardroom. It doesn't happen in a conference room. It happens when someone has a profound healthcare need and they go seek services from the system to help them deal with that need. And so we have to get this back to a patient-centric dynamic where we focus first on the people we're caring for, and then we build around that group what we need to do to make them better and healthier and more successful. The other stakeholder that obviously plays a part in this are the health plans and the TPAs that actually are the administrative middle people in the transaction. The level of complexity that they both have to deal with and that they create is astounding. So this is just a snapshot of the state of Washington and the organizations on the left that are licensed to provide healthcare services and health plans to people in Washington. And then the arrows are obviously meant to suggest that chaos of the health plan marketplace impacts providers in a way that has just paralyzed and frustrated and discouraged many providers to stay in this thing. And in the end, it's the provider that delivers care, and it's the provider that's responsible for providing the data or the evidence that what they did worked. And there are so many data sources and inability to collect all that the health plans and the HMOs and the intermediaries are struggling to find their place in the future world as well. But what they do is very important, so we have to find a way to make them part of the conversation, not the villain, not the place we turn to point fingers. And then we get to the providers, which again, as I said, since healthcare happens between a patient and a provider, the provider network and system sits at the very core with the patient in this revised community system. And this is just some examples where we're seeing provider reorganization and innovation. The telespeech concept that we just heard about, it fits beautifully into this, which is a way for providers to reach out differently to the community to fill a need that currently was unmet or poorly met. Providers have to find a way to win in this game too. Healthcare can't happen if there aren't providers to provide care. and they have to find a way to make it financially viable for them, and we have to find a way to make it satisfying for them, and we have to find a way to let their innovations flourish and not die because we were unwilling to invest or collaborate with them. Or we can wait for an employer to show up in your community and tell you what you have to do. So this is just a small representation of some of the mostly employer-led initiatives to try to get providers to do what they want. I work with some of the employers that are listed here. The dynamic that some employers have taken to this, which is I'm going to find a way to maximize my gain and pass that on to the provider community, is not a healthy dynamic long term, but it's the game the employers have to play because they don't know how else to do this. So you're seeing all kinds of evidence where for certain therapies, certain conditions, certain clinical profiles, an employer is swooping into a marketplace and saying, I'm going to direct all my care to one facility, one provider in that community for a certain set of services because they don't see anyone else innovating. They don't see the provider self-innovating, so they have to innovate on behalf of the provider, which is never innovation. It feels like it's a punitive relationship, and that's something that I don't think we want to encourage either. And so the other area of focus that providers are thinking about, talking about, and in some markets building out, and this is where I'm going to get into what we're seeing with other communities and what's happening in the provider marketplace, is the development of these things called the accountable care organizations. How many of you know what an ACO is or have heard about an ACO, right? So a lot of talk about ACOs. The health plans are certainly building versions of ACOs to market to their employer clients. But at its core, the ACO is almost the perfect way to deliver care in a community because it is a perfectly aligned, patient-centric infrastructure that allows for the care and outcomes to be what matters, not the volume of services provided to a community. And the ACO wins when they improve the health and outcomes of the community, and they don't win when they aren't able to move the needle on care and quality. And so there are some great examples of ACOs that are being developed in Phoenix. The Banner ACO in Phoenix is up and running. Memorial Hermann in Houston. There's a lot of examples of ACOs. The challenge with an ACO is it has to be an all-in solution for it to be successful. And all-in means it has to be a risk-bearing entity. It has to be willing to trade off reimbursements between different parts of the system because one part of the system is doing better than another, and that has to be okay. And that's a hard thing for providers to rally around unless there's either an urgent external catalyst that requires that they do that, or there's an internal sort of desire to do the right thing in a community. And that's what I hope that Pullman can do here is think about how to do the right thing in Pullman. Doesn't mean we have to create an ACO, but it means we should be taking some of the elements of an ACO or an accountable care organization and building it into how we think and talk with each other about how care should be delivered and how care should be reimbursed in this community. So there's some opportunities. I won't read the bullet points in the interest of time, but we are seeing more and more after the Affordable Care Act as people have looked at the system and the opportunities and said, maybe we should be thinking more community-based. And the individuals there are more and more people, my sons being some of them, that want to live in a place that cares about their health. They either want to work at a place or live in a place that actually has health as a priority. I wasn't like that. I went to school in Milwaukee, Wisconsin. It was not the most healthy environment for a lot of reasons. Providers want to find a way to actually have a positive part in the new revolution, and so they want to find a way to bring communities together, and that's exciting, and that's what Scott and Pullman Regional Hospital are trying to do. And employers, the clients that we have a chance to work with, are starting to recognize that if they can create or help create a healthy community for their workforce, people will actually stay and perform better for them, which is sort of a good thing for an employer. And so this thought of a healthy community is starting to gain a lot of traction in our conversations with providers, health plans, employers, and individuals. And so the question to the audience and to the community is Pullman ready to start talking about creating a community of health here that's different than how it's been in the past? And some of the things you have done are literally in the front of the pack, not just in the region or in the state, but nationally. So how do you leverage that leadership that Scott has provided with the team here to keep pushing it? And how do we bring the parties that need to be together to have a different kind of conversation going forward so that Pullman is taking advantage of the opportunities that exist versus waiting for the axe to fall and having to deal with the implications of that? So Scott mentioned the triple aim. So it is the Institutes of Quality laid this out. There's a lot of great white papers and articles written about this and some very interesting dialogue, but at its core, there is not a single person I've ever talked with that could argue with any of these, right? So you talk to any audience, who wouldn't want to be part of something that improves health outcomes, lowers costs, and ensures high-quality, patient-centered care? It's literally a flag should fall behind me and unfurl, and some music should swell right now about how, but at a community level, if we have this as our goal, it's where all the circles intersect, where the providers, the employers, the people, the health plans, the ancillary, the faith and other parts of the community all can come together and say, we are all in on this, all in. So now the question is, if we're all in to do these three pretty challenging but important things, what do we have to start doing differently than we're doing today to achieve this in Pullman and be able to have the kind of conversations that you want to have with other people in the community about what you've been able to accomplish together? And so when we've done a lot of studies and we've done work with organizations and hospital systems and employers to try to build the kind of community that Pullman's talking about, these 12 competencies or sets of criteria are the sort of ultimate things. If you could have a system and an infrastructure and a community that had these 12 elements already thought through and worked through, you have achieved healthcare nirvana. No healthcare system that I know of, no hospital system, no community has achieved all 12 of these just yet. And I would suggest to you that if you try to do all 12 all at once by 1/1/2015, good luck to you. You won't see me again because I don't want to be here when this thing doesn't work. So trying to do all 12 all at once is not a strategy that you should embrace. But you should start thinking about, as a community, what can we do together, one of these or one part of one of these, to make progress. And that's sort of the challenge that I'd like to lay out, and I know Scott has a call to action for you all on that. So at the community level, two fundamental and foundational things that we should think about. One is, how do we continue to address the health of the community so that we don't have as much healthcare need or unnecessary need, because that just consumes resources. And I don't know if anyone feels resource rich these days. So let's not consume resources that we shouldn't, because we have health challenges that we could have prevented because we didn't get ahead of it. And how do we fix the system? And fixing the system means reducing those gaps I talked about, taking out the inefficiency and waste in the system, finding a way to do the right thing for everyone. And when we do the right thing for everyone, we actually spend less dollars and the system is more functioning than if we all try to maximize our own gain and try to find a way to pass the loss on to other people within the system. So that's easy to put on a PowerPoint slide, right? I'm not very good at PowerPoint, but adding arrows and words is really easy. The hard part is deciding how you build the community, take advantage of the opportunity. You know, the trite, it takes a village cliche here, it was put in here intentionally. You know, we can't make a difference if we're not making it together. And so what if this was something you guys could state at some point in the future as a community? So that's why there's we's in here, not you's, because I wanted to make this more of a, what if you could get up in front of an audience or the community, and not just Scott, but all of you, and sort of lay this out as what you attempted to accomplish, and isn't it great that we were able to do that? Because creating a healthy community creates a high-performing community, creates a community people want to be part of and live in and raise children in and have careers in and care about. And if we can do that, starting small, but gaining momentum once we have those victories, think of the possibilities you guys have here. And so I work with clients in Richmond, Virginia, and in San Antonio, Texas, and Austin, Texas, and Greenville, South Carolina, and Atlanta, Georgia. And those communities, as caring and as innovative focused as they might be, can't do what you can do in Pullman because you're Pullman. Because you have innovative leadership, you have stakeholders that are really going to come together, and there's a permanence to this community that doesn't exist in the bigger cities. And so true innovation in healthcare, I think, will come from communities like Pullman. It won't come out of the big cities. So let's play to our strengths here and do great things quickly before we're forced to create a kind of world and a kind of community that we want to raise our children in. So my last slide, my chance to sort of give Scott a softball so he can do its call to action. But healthcare at the community level, is not a spectator sport. You can't sit back and let someone else play. You have to play. You have to be in it, and all of you have to be in it to make it work. 7 things listed here. I won't read them to you. You can read them yourselves. The challenge is identifying who the stakeholders are, letting their voices be heard early in the process, recognizing trade-offs, acknowledging trade-offs, collaborating on a way to work through those trade-offs in a meaningful and consensus-driven way. And all of you embrace your role so that you can achieve those 3 goals of the triple aim as a community. You can leverage innovations that you've been able to do, like Brian's organization in Gemini. You can do the cool thing with copper that I really don't understand completely, but it was the coolest thing I've heard in a really long time. You can look at the brace that was created through the entrepreneurial boot camp that was driven up, and just say, God, that's the coolest thing too. And innovation happens because excited, talented, passionate people drive it forward. It doesn't happen outside of us, and then we just say, oh, this is innovation, isn't this cool? It has to happen from within, and it needs a catalyst, a person, an organization, a mindset to get it started. And I think Scott has toppled the first domino. I think through your work and through your efforts and through your great innovations, you've pushed the first one over. The question now becomes, can we keep the dominoes falling by having more people help push over the next ones? And that's sort of the opportunity you have, and I know it's a challenge, I know it's complicated, I know you have other things you care about, but isn't it cool to care about your community more than sometimes we think we should? And the health of that community is what matters, not just today, but tomorrow. So I'm excited for what you're trying to do, and I would encourage you to try to do more than you think is possible, because then you can sort of step back from that and do something that is actually pretty successful and can be measured, and other people look at you as the model of innovation and community health, not waiting for someone else to innovate for you. So I tried to go fast because I recognized that I was the last person that had to sort of keep you from what you wanted to do other than have a great meal and listen to really cool stories and touch copper over there on the left. So with that, Scott, let you come up here and close us out.
It's not a very profound call to action, but I don't know how to get it started except to say, here's my name and phone number and email address. There are business cards on the table. If you want to be a part of the conversation, give me a call, send me an email, stop by the office, say something here before you leave tonight. And if we can get a critical mass wanting to start to talk about what we think is important and how we can change what we're doing to achieve what we think we want, then let's start. Thank you for coming tonight. We think that Pullman Regional Hospital doesn't have all the answers, but we have an opportunity to provide leadership in defining what innovation in healthcare is like in this region. So our invitation to all of you is to come and join us. Let's be a part of it. Thanks, and have a great evening.